Let me take you through a big story. Today is World AIDS Day, and new data that's coming in, especially from Karnataka, gives us a mixed picture on HIV. Among the general population, including routine testing for pregnant women, HIV positivity has gone down, thankfully. That means awareness and screening is working, but among key high risk groups, the situation at this point seems to be worrying. Across 6 groups, the situation has worsened, and that's female sex workers. Among MSM groups, that's men who have sex with men, gays as we call them, transgender and hijra communities, injecting drug users, migrants, and transport workers. This is a high risk group where the numbers of HIV has gone up. Now, I'm talking about Karnataka limited to. Karnataka carried out over 17.6 lakh tests in recent years, and HIV positives have climbed every year. So, to give you some figures, in 2020, HIV cases in Karnataka was 182 among these high risk groups. And then in 2021-22, it was 243. 2022 to 23, it was 336. Then in 2023-24, it was 564, and 24 to 25, it's jumped to 828. Again, only in this high risk group. The rise of nearly 60% in 1 year alone. Transgender and hijra groups have the highest positivity percentage, meaning a large share of those who are tested among this group are showing positive. Even though fewer people are tested in these communities, though, MSM, that's men who have sex with men, have consistently recorded the highest number of HIV positives. In 2024-25, female sex workers briefly overtook MSM group, raising concerns about new transmission pockets. Injecting drug users, migrant laborers, and transport workers are showing lower positivity, but with fluctuations that health officials are currently very closely tracking. So the epidemic here is shifting. The general population by and large is safer. Numbers have come down in this general population, but these risk groups are becoming more concentrated in specific, risk is becoming more concentrated in specific communities. Experts say a key reason to reduced HIV, though, is basically experts are suggesting the key reason to this rise within the high risk groups is lower funding of HIV aid worldwide. Some clinics have cut services as well. Outreach has also slowed down, and this could really lead to thousands of preventable infections in the coming years. So the blame, of course, is in the larger aid that was coming earlier from world groups and organizations and NGOs to clinics all over the world to ensure HIV is addressed. But at this point, that seemed to have terribly slowed down. HIV has not gone away. Targeted prevention must return to the front line. HIV aid at this point is primary. We wonder why it slowed down. Let me bring our panelists on board to give us a little more insights into why this rise in certain groups, particularly Karnataka numbers we played out for you. We have joining us Shyam Konur, who's a founder and CEO, Mist LGBTQ Foundation. Thanks, Shyam, for joining us. He's from Bengaluru himself. We also have Dr. Ishwar Gilada, who's a consultant doctor, infectious diseases, and Secretary General People's Health Organization. Thanks, both of you, for joining us. Shyam Konur, do you want to give us a little sense of the risk of HIV among LGBTQ groups? Largely in Karnataka, the reports have come, seem to be alarmingly high. Give us a sense of what your study is as per your foundation. What have you found?
So we also work on HIV testing, mostly I would say self-testing. We were supported by these organizations that you were speaking about globally too. And to what you say, I would say not just for testing, but to create awareness, to encourage communities. So it's easy for a community member to reach out to us as a community organization because they trust us. So because of the fund cut, there were a lot of what you say organizations have to shut down or cut down on their staff, on creating awareness efforts have been gone down. Uh, if people who can afford can go to a private clinic, but we see that there are things like Aadhaar card requirement for doing a HIV test. So there are some these kind of things people hesitate to go and regularly have their HIV tests, or they're scared to talk about that they need help with the HIV testing, or, for example, like you said, drug user community. So the drug user communities and many other people are scared to come to us or take help. So that's one of the major thing I think in the terms of the rise. I know that because of the fund cut, our global target that we had to end HIV by 2030 will slow down for sure. I remember that when we went to the World AIDS Conference last year, which was in Germany, there was a improvement. Like we were going to get PrEP, which is like 6 months once injectable PrEP. Now I feel that will also slow down, or that will also be delayed in coming to India. That's the feeling that I have with what's happening with the current funding situation. Yeah.
Okay, that's interesting. Dr. Ishwar Kilada, Doctor, we're looking at Karnataka data showing some alarming numbers within the MSM groups. That's men who have sex with men, transgender and hijra communities. Why do you think so? This was always a high-risk group. Could you give us a little more? Funding has been cut to ensure awareness, and many still see HIV as no longer a threat. Also, at the same time, the numbers have reduced in the general population, but these high risk groups still to be seen as high risk. Why do you think?
Thank you very much, Nabila, for having me on the show. And this is a great day, which started almost 40 years before. And now we observe this as a World AIDS Day. Let me tell you frankly one thing, that India's National AIDS Control Organization and program is one of the most lauded program globally. And it is 100% funded by us, by our own funds. And that's the reason that despite funding cuts globally, it did not collapse. The program is going on. Yes, there are maybe 5% of the intervention projects which are supported by international organizations, particularly from US, where the funding cut has been there. Organizations have been completely closed down, like USAID. UNAIDS is likely to be closed down next year. Now, the issue is, I sense almost 5 or 7 years before that HIV is increasing, and nobody believed me, because when HIV awareness started in 85, 86, and thankfully it was started by me in 85. First AIDS clinic in the country was started in 86. From then, it took almost 10 to 15 years time to have a national scenario where everything was kind of built it up. And then HIV started going down because condom awareness campaign was very powerful. Not only HIV, all other sexually transmitted infection went down. In 2004 and 5, when the government of India started ART program, antiretroviral therapy, then the entire prevention program took a backseat. So if you look at the national budget, almost 98-99% is going for treatment and care and support, and hardly 1 to 2% goes for prevention. So prevention campaigns are poor. Intervention campaigns among the high risk behavior community, sex worker, LGBTQ community, they are poor. They are not supported. And we thought that everything is going on well. But what has happened in last 10 years, that STDs have started rising again. Why? There are a couple of reasons. Number one, the Section 377 is repealed, and we thought that something will be properly done. But people were already, the LGBTQ community was there for long back. So only act is repealed or mindset is not repealed. Or mindset is still discriminatory, creating stigma, don't have an enabling atmosphere for them to come to clinics. And therefore they do not come. At the same time, when they don't come to the clinic, you go to them, and one of the way can be a mobile clinic, etc. But HIV self-test. HIV self-test has been a kind of backbone of finding out the last milestone. And for last 9 years, 10 years, it has been happening in smaller countries, but not in India. It is not part of the national program. Secondly, we do not give pre-exposure prophylaxis. So what our government does, that you get HIV and you come to us, I'll treat you free of charge for whole life. But I will not give you tools to prevent HIV. I will not give you pre-exposure prophylaxis. So this is a dichotomy. Sham just now said that there will be injection which is going to come once in 6 months you take and you prevent HIV almost 100%. Now India will make that injection, make available for 115 countries in the world, but India cannot use it. Again, because there's a dichotomy with the Drug Control General of India.
Correct.
They say that to use in India, you do Indian trial. To do an Indian trial for any company, they need to spend 5 to 10 crore rupees. Who will spend? From the money, where the money will come? So when there are a multi-centric trial which establishes globally that this product is working. Government of India allowing them to produce in India, sell to all over the world, but not to be used in India. Again, this is dichotomy. So I think there is some policy paralysis, and there need to be some kind of
Yeah.
good valid discussion, and that's the reason we should be able to come together on such kind of day like World AIDS Day. And last but not the least, the communities which are badly affected, they need to be taken into confidence. They need to be taken as a human being, not they, not we,
Yeah.
all of us, amongst us. I have been a
No, I know,
person.
I know, I know. So
We have
stigma
done
should no, but
exactly.
we are living in much better times. Don't you agree, doctor? We are living in much better times. That stigma was there at one point. I think people are now more educated, more exposed and learned and understand. So the stigma is in that sense slightly, toned down. I surely would say that. But at the same time, you believe that they're not coming out, they're not taking early treatment. That's your assessment, that high-risk groups like gays, like transgenders, hijra communities are not coming forward to actually take timely treatment.
No, no, stigma has not come down. It has been reduced. Stigma is still there in minds of people, and more stigma in those people which are highly qualified, highly educated. I'm sorry to say that even in our own community, medical community, there is high stigma among surgeons, among gynecologists. So whenever they treat HIV positive person, they will say that person should be last on the list for surgery. We will fumigate the theater. So that stigma has to go away. But here the stigma related to LGBTQ community is that legally now they are accepted, but socially they are not well accepted. And unless and until there is an enabling atmosphere, we don't give a bad look to them, we don't ill treat them, we treat them with honor and dignity, they will not come forward. So you need to have a LGBTQ friendly atmosphere, and that atmosphere is hardly at 10 to 15% of
Yeah.
medical care centers, not 100% everywhere. So that's the reason that they will not come. Even if they don't come, if you can do pregnancy test at home, COVID test at home, sugar at home, why can't you do HIV test at home? Why that is not part of the program? So you can buy HIV
Correct.
self-test on Amazon, but it is
Correct.
not part of the program. So it has to be part of the program to make it acceptable to most people.
Doctor, but a quick one, if you can educate us,
Yeah.
if you can educate us in a nutshell, how does one contract HIV?
97 to 98% contraction currently is sexual, and sexual can be male sex with male, bisexual, heterosexual. Other 2% is from injection drug use. It can be accidentally from blood transfusion, because everywhere blood is screened, but they can be in window period, and mother to child transmission. So all these three other, they constitute only 3 to 4%, not more than 3%, 4%. 96 to
So,
97% is sexual.
doctor, would you say that protected sex is the only preventive, the best baseline prevention? Protected sex is the best baseline prevention?
Very good question, and the best answer is protection has to be barrier protection like condom. Today, what has happened after pre-exposure prophylaxis and post-exposure prophylaxis awareness, the condom has taken a back seat. So you can prevent HIV by taking PEP or PrEP, but you get other STDs, and all other STDs are going up. You take syphilis, you take herpes, you take gonorrhea, chlamydia, you take HPV, they are all increasing, and they will outnumber HIV in no point of time. HPV and hepatitis B, they are very common, and they are both vaccine preventable. Hepatitis B vaccine is a peanut cost. In 100 rupees, you can get 3 doses. It is not done. HPV is expensive, but we talk about only preventing women because of cervical cancer, but men also get penile cancer and anal cancer.
Correct.
So we need to focus on all STD, and for that prevention, you need condom.
Right. Right. All right, doctor. Thank you very much. A final word I'll take from Sham. Sham, if we're looking at a high risk group at this point, largely people belonging to the LGBTQ, a quick take, your message as part of your foundation, or your reassurance on what kind of community building are you all doing at this point? What kind of safeguards are you all ensuring? How you all sensitizing people within the community to ensure that they are safe?
So I would say that we regularly try and like doctor said, pre-exposure prophylaxis is what we also promote in our organization in NGO. We subsidize the prices for them. We subsidize the rate so much that it can be affordable for people. We also give PrEP for free if a trans person is interested, and they are regularly ready to come and take advice from us or check their medical history. We have doctors who keep a check on them. So we also advise them to take it for free from us if they are unable to afford it. These are some things we do. We try also educating people that PrEP is not the only solution. You need to be practice safe sex practices. So we also distribute free condoms. These are some of the programs that we do. We encourage people to come talk about what they feel. We encourage them to be comfortable. So we have a helpline where people can call and speak anything that they want. So that way we try and make them feel comfortable to come and access services through us. We also work, luckily in India, because of all the ART centers, the government does support with treatment. Many other countries, these support are not there after the fund cut. They are struggling with this. So I'm glad that in India, the government at least supports with the treatment. But they need to also, increase the prevention.
Yeah.
Yeah.
Surely, yeah. Thank you very much. More power to you, Shyam, and your organization. Do great work, and Dr. Ishwar for enlightening us on this. Thank you.